Hello, thank you so much for tuning in. Dr. Kehinde Elisha speaking here. So if you're yet to see my previous recordings on Stahls Psychopharmacology to support students in school or students that are looking into getting into mental health, or even to help students that already graduated and they want to relearn their foundation, please go back to my channel and locate that video. We did chapter 1 through 5, which kind of like discussed the foundation, the neurotransmitters, and the signaling and all that, with some questions to back it up. Today I'm going to pick up from chapter 5. I will take a chapter at a time, and just to make things clear and so as to isolate things. I'm also going to be doing 2 questions per chapter with a little bit of content and Dr. K's pearls to follow it. Dr. Kehinde Elisha speaking here, founder and CEO of MP Certification Academy. To reach us, nursetonursecoach@gmail.com or visit www.npcertificationacademy.com. If you hear any kind of sound on the background, it is raining right now in Virginia. So sorry for the noise. At this time, we're now going to get started with chapter 5 of Stahls Psychopharmacology, 5th edition. Thank you. All right, so I'm going to get started by reintroducing myself. So who am I? I'm the founder of MP Certification Academy. So what do we offer though? We offer FMP, AGMP, AGACMP, NCLEX exam review, and we do pretty much most companies like AAMP, ANCC, and AACN. So definitely reach out to us if you need some support. We also create courses for the experts, www.confidentprescriber.com. So who are the experts? Of course, if you pass your board exam, you've crossed over to, from students to experts. So we call you experts. So if you want to upgrade your skills when it comes to how to prescribe, how to titrate medications, networking, what to do with your degree, you mean being in the right group and networking with people, of course, that is the right place. That's the community for that. Okay, so we're now going to go ahead and shift gears and move on to chapter 5. So what is chapter 5? Chapter 5 is targeting dopamine and serotonin receptors for psychosis, mood, and beyond, so-called antipsychotic. So what are the concepts to learn here? The key concept to learn from this chapter: antipsychotic primarily works by blocking dopamine, which is D2 receptors. Now, this is one thing. There is a foundation that is needed before you really, get a good grasp of this. For example, you have to know your neurotransmitters. You have to know the keywords to identify them. You have to know what receptors, that they work on, and many of the drugs class and drugs and class and so on. So if you're not there yet, this chapter may be a little bit confusing, but I will do a little bit of work on helping you understand it though. So look, there are 7 common neurotransmitters as discussed previously. Dopamine is one of them. Serotonin is one of them, right? So we're talking about the dopamine and serotonin receptors here, okay? Receptors for psychosis, mood, and beyond, and so on. So particularly we're focusing on antipsychotic as well, which is partial D2 agonists like aripiprazole modulate dopamine rather than fully blocking it. Is used for schizophrenia, bipolar disorder, and so on and so forth. Dopaminergic pathways are mesolimbic, mesocortical, nigrostriatal, suprainfundibular. So there is no way to talk about antipsychotics that you're not talking about psychosis in general. When you're talking about psychosis, of course, schizophrenia is one of them. Listen, for schizophrenia, we tend to block dopamine, right? Now, when we block dopamine, we tend to, the main area that I want to block dopamine is mesolimbic pathway. But then we end up blocking dopamine in other pathways. And then we see the symptoms as, like a side effect of it. So for example, now if we block dopamine in the mesolimbic pathway, the focus is to target the positive symptom. When we target the positive symptom, then we're able to have a resolution of symptom, because we don't want them having hallucinations and delusions. Now that's another concept you have to know. So there's a kind of a lot to know, really. I cannot summarize this place in just a minute, so I have to keep it moving. If you want to know more, please go to our website, www.npcertificationacademy.com or www.confidentprescriber.com. So I'm going to keep it short and sweet though. So mesolimbic pathway, we're trying to block the positive symptoms. When we block the positive symptoms, we end up blocking other areas like mesocortical. Now when we block the mesocortical, baseline, mesocortical is already negative. When we block it, we're going to block it further, right? Making them more, flat. Anhedonia, we're going to see more of these symptoms in them. Now, in the nigrostriatal, when we block dopamine in this area, we're going to see extrapyramidal side effects. With the tuberoinfundibular, guess what we're going to see? enlarged breasts are due to hyperprolactinemia. That is the best way I can summarize this, but it's more loaded, okay? So now, what is my purpose for this chapter, for chapter 5? Just know that aripiprazole can be activating, it activates. Meanwhile, clozapine calms. So that means they are not all equal, even though they belong to the same class. Second generation antipsychotic. Don't just chase side effects if you see them. For example, think upstream. So what's driving the symptoms that you're seeing? That's the way to think about, instead of chasing side effects. Now, if EPS shows up, reducing the dose or switching the med may be necessary, okay? Just don't cover it with penstropine. So we don't want to wait for things to get worse. For example, you may just be seeing a dystonic reaction. Just don't cover it up like it's nothing. You want to go ahead and take care of it ASAP before it turns into tardive dyskinesia. Now, we're now going to move on to some multiple choice question to target chapter 5, so don't forget, we offer AAMP, ANC exam review for PMHNP, FNP, AGMP, and AGACMP. AGACMP do not have AAMP, they have ANCC and AACN. To reach out to us, please call 347-901-6037 or visit www.npcertificationacademy.com. If you're still in school, stay connected. Remember to subscribe to our channel so you can continue to get more good stuff to get you through school. Dr. Kehinde Elisha speaking here again. We're now going to go ahead and get started with Q&A. So now, question 1. Which mechanism best explains why second-generation antipsychotics have lower EPS risk than the first-generation agents? A. Stronger D2 receptor binding affinity. B. Increased histamine receptor antagonism. C. 5-HT2A receptor antagonism permits dopamine release in the nigrostriatal pathway. D. Enhanced GABA activity. So again, I always say there are no strategies without content. Listen, there is no way to answer this question right here without some level of knowledge. So what knowledge do you need right here? For example, first of all, you got to understand what second gen is. When they say second gen, what class of drug are they referring to? We know is, of course, is the SDRA. And like, okay, Kehinde, what the heck is SDRA? Well, they are referring to what? The atypical antipsychotic. So it's kind of interesting that we have 3 names for just one drug. And this is kind of an area where students get confused. There is a lot more to learn. Just go sign up. www.npcertificationacademy.com. Now, what is the next thing to know here? The next thing to know is, okay, what exactly are they asking me? They are saying that, okay, which mechanism best explains why second gen have a lower risk? That is the big question right there. And the big question has to come again with your understanding that, okay, with second gen, what are we blocking? We are blocking 2 things. We are blocking the 5-HT2A and we are blocking what? The D2. Now, for first gen, we are only blocking the D2. And that makes it typical, right? That makes it typical. The old school guy works 80% of the time to pay off his bills. Now, the new gen is smart, only works 60% of the time, and then have a girlfriend to work a little more for 20% of the time. I mean, that's like my serotonin right there. That's my little story to help you remember that, hey, second gen is mixed with 2 things. Second gen, we have 2 neurotransmitters. First gen, 1 gen, right? We have just 1 thing being blocked. So that is very, very critical to what we do. You have to understand what D2 means, what we are blocking, and when we block, what does it really mean? So anyway, based on this response, what is your final answer? Please drop your answer in the chat. All right, if you have to pause this video, please do so. But at this time, we're going to keep it moving. The final answer is going to be C. Based on my explanation, right? Your foundation is extremely important to put all of this together. No strategy without content. So 5-HT2A receptor antagonism permits what? Dopamine release in the nigrostriatal pathway, period. All right? So that is the mechanism that best explains why second gen have lower EPS risk than the first gen. That is pretty much the main mechanism. So 5-HT2 antagonism allows dopamine release in the nigrostriatal pathway, reducing extrapyramidal symptoms. A is incorrect. Why is that? Stronger D2 binding will increase EPS to start with. Don't forget, blockade at 80% is what is making our first generation antipsychotic to be notorious for EPS to start with. B is incorrect because histamine antagonism causes sedation, not extrapyramidal side effect. D is also incorrect because GABA modulation is not the key mechanism for EPS reduction. I really hope this helps you if you're in school. This is similar to what they're going to test you on if you're using Stahls Pharmacology book in your school. And even if you're not, on this particular concept, this question is frequently tested. So after you pass your coursework and you graduate from school, please don't forget to come connect with us at NP Certification Academy, www.npcertificationacademy.com. Question number 2, which is the final question before we wrap this up. You may watch out next week, but remember to subscribe so you can be the first one to get this notification. We're going to be going to chapter 6 of Stahls Psychopharmacology. But now, question 2. Which antipsychotic is a partial dopamine 2, which is D2 receptor antagonist? Agonist. Listen, that was a mistake. Don't say agonist when you mean to say antagonist. Do not say antagonist when you mean to say agonist. In this case, I meant to say D2 receptor agonist, and has a lower risk of hyperprolactinemia and EPS. A, risperidone. B, aripiprazole. C, olanzapine. D, haloperidol. Let me tell you, the key to succeeding in pharmacology is a lot, okay? There's a lot of foundation that you have to understand. This is not the place to start. If you're really struggling with pharmacology, I recommend you sign up for a review or sign up for a Confident Prescriber course so that you can learn your pharmacology throughout school. But my point is there's a lot that goes into this question too. However, repetition, and exposure will also help you retain the information. And based on the knowledge, we know here that the one with the lower risk of hyperprolactinemia is not risperidone, is not olanzapine, is not haloperidol. By the way, you can also do a POE, process of elimination, also based on what? Based on your content. And we know the final answer is going to be what? B, final answer. So aripiprazole is a partial D2 agonist, don't forget, and serotonin modulator. And because of that, it stabilizes dopamine rather than blocking it completely. All right. Now, A is wrong. Why is that? Because risperidone has a higher D2 antagonism associated with EPS and hyperprolactinemia. C, olanzapine is effective but associated with metabolic syndrome. D, haloperidol is a typical antipsychotic with a very high EPS risk. This is how we know that B is the final answer. I really hope that this helps. Thank you so much for tuning into our channel. We look forward to having you in our review or in our community of experts that passed their boards already. The next chapter is now chapter 6. What are we going to be talking about in chapter 6? We're going to be talking about mood disorders and the neurotransmitter networks, norepinephrine, and gamma-aminobutyric acid. That is what I like about Stahls. It kind of breaks things down into different neurotransmitters so that it's not so overwhelming. To reach us, nursetonursecoach@gmail.com or visit www.npcertificationacademy.com. That is www.npcertificationacademy.com. Or you can visit www.confidentprescriber.com or email nursetonursecoach@gmail.com. Today we're going to say bye-bye and have a wonderful day.